In 2011, I was diagnosed with PCOS, and I was told by my doctor that I will have a harder time trying to conceive in the future. And according to Women's Health, about 1 in 10 women is affected by PCOS, and is also the leading cause of infertility. And also, a lot of women actually do not get diagnosed with PCOS until they are ready to start a family and fail to conceive and turn to the doctor. So what I want to talk to you guys about today is to tell you what PCOS is, what are the symptoms, and what are some of the treatments available for this disease. Well, not disease, health condition. So let's start off by defining PCOS. PCOS starts for polycystic ovarian syndrome, and according to WebMD, this is a health condition that affects women in the reproductive age, and this is a condition when your hormones are out of balance, which can cause a woman not to ovulate. So normally, when a woman ovulates, her body releases two hormones: luteinizing hormone, also known as LH, and follicle stimulating hormone, also known as FSH. Now, these two hormones stimulate the follicles in your ovaries, which to mature and grow into eggs. And each month, when the LH and FSH is released, it stimulates the follicles to grow. The one that is most mature is when you end up releasing that's the egg that you release for the month. So when you have PCOS, your body releases an abnormal level of LH and FSH, which still stimulates the follicles to grow, but in that process they fail to mature, so you don't release the egg by the end of the month. Therefore, you don't ovulate. These follicles are left in your ovaries, creating that cystic-like appearance on your ovaries, which is why this disease is called polycystic ovarian syndrome. Now, these follicles are believed to stimulate testosterone production. So, when you have testosterone production, this is also a hormonal imbalance because you will end up having more testosterone than estrogen in your body. So let's move on to how you can get diagnosed and some of the symptoms you might experience with PCOS. Some symptoms of PCOS can be irregular menstrual cycle, acne, excessive facial or body hair. You will also experience the trouble to lose weight, obesity, insulin resistance, and etc. Now, in a healthy woman, a menstrual cycle is usually about 28 days. And in those 28 days, about every 14th day during your cycle, you will ovulate. Which, when you have PCOS, like I mentioned before, you don't end up ovulating. And when you don't ovulate, the egg is not released to your fallopian tube, which causes your cycle not to be completed. The uterine lining, or the endometrium, just stays here and doesn't get shed because the cycle is incomplete. Now, when you have a thick uterine lining, your doctors will be concerned because it also increases your chance of having uterine cancer. So that is why you need to proceed to treatment, because it does increase the chance of ovarian or uterine cancer. And a lot of women I find actually associate PCOS with obesity. They will experience some of the symptoms that I've mentioned above, like the excessive facial or body hair or the irregular menstrual cycle, but they never associate themselves with having PCOS because they think they're not overweight. But the truth is, you can still have PCOS without being obese. Now, this is why you should really go to see a doctor if you have some of the symptoms I've mentioned above. Now, the way you can get diagnosed is that first, which doctor should you see? I got diagnosed with PCOS by my gynecologist, so you could consult any type of doctor. You can see your family doctor and tell your family doctor about your symptoms, and if your doctor thinks you should see a specialist, you can see a GYN doctor as well. Some of the things that you have to do for getting diagnosed is blood work. Now, blood work can include multiple blood works because, first of all, if you have a thyroid issue, it can also cause you to have irregular cycle and have trouble losing weight. So the doctor might want to run a test to check if your thyroid is doing okay. A transvaginal ultrasound might also be performed to check if your ovaries have those cystic appearance, like I mentioned before. And they will also ask you about your family history. If you have a family history of diabetes, your chance of PCOS can increase according to WebMD and Women's Health. Now, there is still no actual cure for PCOS, and the doctors have not been able to clearly understand what is the main cause, but there are treatments. One of the treatments that can help with PCOS is weight loss. Now, doctors believe that when you lose weight, like even 10 pounds, it can stimulate your body to regulate your hormones by itself and stimulate ovulation. And also, some of the medicines can help with the symptoms as well. One of the most common medication used for PCOS is birth control. And birth control is used to regulate your hormones so you get a period every month. This can help with some of the symptoms. For me, I personally was taking birth controls and also metformin to help me regulate my cycle, and I also lose a ton of weight when I was taking those medications. And also by doing some research, I found out from some academic journals that myoinsitol also helps with regulating the cycle, and simvastatin also can help regulate the cycle. So now that we've reached the end, I've told you a little bit about what PCOS is, what are the symptoms you might experience, and how you can diagnose your PCOS. I really hope you understand a little bit more, and if you have some of the symptoms that I mentioned above, you should really go consult a doctor. Thank you.